Well, good morning and welcome back to the Active Physical Therapy Zoomcast. My name is Ryan and I am with Anna Howes, a physical therapist at our Marquette Clinic. Welcome, Anna. Thanks for joining me.
Thank you. My pleasure.
Awesome. Well, it's so good to have you here. It's been an interesting time, and we're trying to find new ways to connect with our audience, our patients, virtually, because we may or may not be able to see them in person depending on their circumstances and our circumstances, which is kind of an evolving thing day to day, week to week, right? And so that's kind of the purpose of this meeting today, is to just kind of get together, talk a little bit about you, your expertise, and some things that you're excited about. So today we're going to be talking about postpartum exercise, what it's like to kind of be getting back into exercise after you have a baby, and all things regarding that type of topic. So, but before we do, I would like to just give you the opportunity to talk a little bit about yourself. Maybe tell us about where you're from, how you got into PT school, and how you got into women's health.
Yeah, I didn't take the quickest path to physical therapy. I'll say that. I actually started as a park ranger in Yosemite National Park. I graduated from Northern first with an undergraduate degree in environmental science, and then did the park ranger thing for a bit, loved it, but realized I wanted to do something more. So I've always been intrigued by the field of healthcare, working with people, and also the body. I've always been a very physically active person. So for me, it was very natural to pursue physical therapy. Did some research into it and jumped into the Central Michigan University Doctor of Physical Therapy program. So then, fast forward a little bit, go through my schooling, love working in outpatient orthopedics, and then I became pregnant. So it came as an opportunity to go more into women's health, and the timing was just right, as I was, first-time mom and pregnant for the first time and getting into women's health. And honestly, over the past year, I've just become really passionate about rehabbing the pregnant and postpartum woman. So now I am 5 months postpartum, and I have a 5-month-old daughter who I love dearly, 5.5 months now, actually. And, going through this process of pregnancy, childbirth, and postpartum has really opened my eyes into this whole other specialty niche of rehab. And you learn about it a little bit in school, but in physical therapy school, that is, but you only get a little bit. And so I've just been totally engrossed in this whole new realm of physical therapy. I've been really enjoying it.
Yeah, that's amazing. Well, congratulations on your new little one addition to the family. What have things been like for you at home with the new baby? Is she sleeping well?
She is. Yeah, she's a good little sleeper, thankfully, because I like my sleep as well, as we all do. But yeah, she's been great. Now we're mastering sitting up, which has been really fun.
Very cool.
Actually, just yesterday, she could sit with her hands, supported on the ground. So yeah, she gets her daily exercises, just like my patients do.
Excellent. Excellent. Well, this is actually, it seems to be a perfect topic for you. And it's my understanding that you were pretty physically active prior to pregnancy, throughout pregnancy. And I imagine now you're looking at what that looks like in terms of your postpartum period. So talk to me a little bit about what that's looked like for you so far.
Yeah, so throughout pregnancy, I was really physically active, lifting weights, running. I had to stop running partway through my pregnancy. It just stopped feeling right in my body. Everyone's a little different there. Yeah, so just listening to my body and then rehabbing myself. So I was in physical therapy for some low back pain, and then also in the postpartum period as well, following childbirth.
What can a woman who's recently given birth, when can she start to return to exercise? And what does that progression look like after birth?
Very, very good question. And I think that we have to start by just saying you need to have clearance from your healthcare provider to begin activity. Typically, that's around that 6-week mark. And of course, before you start anything, please talk with your healthcare provider. Can't emphasize that enough. But after that 6-week mark, most of the time we're given a, okay, you're good to go. And I find that it's kind of hard to understand where to turn to. It's hard to know, well, how do I start? And I think a good rule of thumb is to start with gentle strengthening and low impact activity, just as a baseline, starting to take your little one out for stroller walks and gradually increasing, and then also general strengthening. And a lot of this too is going to depend on how your pregnancy looked. So how active were you? What was your childbirth experience like? Did you have a cesarean birth? How long were you pushing for? So those are factors that are certainly going to come into play when you are returning to exercise.
Yeah, and I can imagine, I always feel that there's a big hump to get over after I take, say, 4 to 6 weeks off of just not exercising. Life gets in the way, whatever the case may be, and how much time and patience that I have to have. I couldn't imagine what that would be like after having a baby. I imagine it's
Oh my gosh.
a process, right?
You nailed it. And I think that when you do get that clearance at 6 weeks, you are biting at the bit to get back to some form of normal.
Right.
Which, let's be honest, even if you haven't been pregnant, 6 weeks and then returning to a high level activity like running, for example, or CrossFit is likely going to increase your chance for injury if you don't do that in a way that's, graduated and slowly building.
Right.
In fact, brace yourself, moms, because current research suggests that you don't start high impact activity until a minimum of 12 weeks. So not running for a minimum of 12 weeks. Some people in the field even say 6 to 9 months before starting something like running or CrossFit. And the reason why that is because childbirth is such I hesitate to use the word traumatic experience because there's such a change in your tissues. I was just reading a study that said that our pelvic floor muscles will undergo 300% of change during childbirth. That is unreal. 300% change in the muscles. So, basically we need the 6 weeks to get ourselves back to, a normal, but it's really a new normal for most of us. So yeah, we need to respect that recovery time and then need to understand that we're not going to just jump right back in it.
Yeah. So it sounds like a gradual progression is on the menu.
For sure. Yeah. And I think patience is key. I prior to being pregnant, I was a marathon runner, have always really enjoyed running long distances. I'm 5 months postpartum, and I am just beginning to start running. And when I say just starting, I'm saying running for 1 minute, walking for 3, running for 1 minute, and checking in the whole time.
What kind of things do they need to be aware of when they're walking through that progression? What's normal? What kind of things should they be on the lookout for?
Great question. Lori actually addressed some of these things in a recent video that she did, but I'll just name them here in case you didn't catch that. So any kind of pelvic floor issues. Sometimes you won't have pelvic floor issues and then you return to something like running or even picking your child up or deadlifting, any kind of thing that's going to overload your system may cause pelvic floor issues. And that would be any kind of leaking, whether that's urine or fecal incontinence, any kind of pain, would not be normal. Any kind of bulging in the abdominal region, so where your rectus abdominis is, it's your six-pack muscle. If there's a split in that muscle, it's called a diastasis. And what will happen sometimes is you can see a bulging in that region. And that also wouldn't be out for as if you feel any heaviness in your pelvic region, or like a feeling that something's falling out. That would be indicative of a potential pelvic organ prolapse, which is just when the surrounding organs start to come into the vaginal vault, and it can be uncomfortable, and it's definitely something you're going to want to address. So I think the first step, if you're feeling any of those symptoms, would be to probably stop and talk to your healthcare provider first. And you may want to mention that physical therapy would be something you are interested in, because there's some really great outcomes with physical therapy and exercise and rehabbing the postpartum woman. So yeah, definitely things to be on the lookout for. Because if you don't address those things or you ignore them, they tend not to go away. Right. And so it's good to seek some help with that immediately. And
yeah, and it seems to me the little bit that I have learned about women's health physical therapy or pelvic floor PT, there seems to be, I've had a lot of friends that have had babies, and you hear this talk about the issues that do develop postpartum. They don't have to accept that as normal, right? Like, there are treatments available out there. People who specialize, people like you and Lori and Lisa, who specialize in this type of physical therapy, that can provide relief from those things. That doesn't have to be the rest of your life, right?
Absolutely. If I could have a soapbox, this would be it.
Let her rip.
We don't hesitate to go into physical therapy if we're having a shoulder issue. We sprain our ankle, we go to physical therapy, and I just wish that more women knew that it's not normal to leak when you jump rope. It's not normal to run and leak. Is it common? Yes.
Well, I have a question on that particular topic. What does a typical treatment plan look like in terms of like the frequency and duration of visits? Like how simple or complex is it to treat an issue like that? And maybe there's not a cookie cutter answer, right? Everybody's probably a little bit different, just like a shoulder injury or a knee injury. But I guess what I'm asking is, how easy is that to treat, and what are the outcomes like?
I think that the postpartum body, in a lot of regards, is kind of like a blank slate. There's a lot of things to work on, and I can't give you an exact answer of 2 times a week for 4 weeks. We're gonna hone it in. I think patience is key, so we're looking at likely maybe a longer duration, and depends on the experience of the woman, what kind of birth experience they had, how much time they can put into their exercises. But I think with looking at regular programming and exercise, we can really hone in and get women feeling better a lot faster. That kind of cues us into the physiological changes during pregnancy. Your center of gravity changes, actually, because you have so much weight forward in your stomach. It can actually change your center of gravity and your posture. Whenever we change our posture, we're looking at different muscles and parts of the body tightening, others loosening. Even if you look at our breathing mechanics really change during pregnancy, which is a really important aspect to address postpartum. So as your baby is growing, your stomach is expanding, your diaphragm, which is the main muscle for respiration and breathing, is actually pushed up, and your rib cage can expand. So then after delivery, you have this baby, and a lot of times those physiological changes in the trunk don't change. And so part of rehabbing the postpartum woman is looking at, how is your posture? How is your breathing mechanics? How are you holding yourself on a day-to-day basis? How are you picking up your baby? Because it's really these things that seem so small that you wouldn't think about that hands down make the greatest difference. If we can't breathe appropriately or move through our day with a posture that supports our musculoskeletal system, how can we expect our body to do high demand activities like running and jumping?
Right.
So really dialing things back down and looking at the small things is really where we can make a difference, I think, in returning people to being the athletes that they were pre-baby.
Yeah, that's awesome. What kind of things do you need to be looking out for, and anyone in your same scenario, in terms of high impact activity considerations?
Yeah. So, I think, again, just talking about how you can do this in a graduated fashion, and certainly having another pair of eyes on you. So physical therapist, Lisa and I are currently taking a course called the Postpartum Corrective Exercise Specialist. And it's looking at bridging that gap between rehab and those more athletic endeavors. So having another pair of eyes on you can really help, because sometimes we don't realize that our deadlift mechanics or our single leg squats, or insert name of exercise here, we don't realize maybe that in period things are going to be different. Even if you had perfect form prior to pregnancy, there's just so much change that happens in the body that you need to be aware. So, seek help if things aren't feeling right in your body. If your deadlifts are making your back hurt, if you notice bulging or any pain, that's when you need to look and say, okay, maybe I need an extra pair of eyes here to see how I'm doing this. And, we can help you with that. But taking it back to more of your question of considerations for high impact, how you're doing it in a graduated fashion, looking at your landing mechanics, if you're doing box jumps, landing mechanics when you're doing jump roping, what is your form when you're running? Because all of those things go into what your pelvic floor is experiencing, the stressors that you're putting on your body. So I think really buttoning up your form is an important part of returning back to sport, if you will, and taking things slow. And I know that's so hard. I have to tell myself patience every day.
I was just going to say, it sounds like there's more patience in order. Patience.
Oh my gosh. Yeah. I mean, all you want to do is, go out for a run. It's sunny right now, and I could just head out real quick and go for a run. But, you really got to think of this long term. You have to, do I want to push the envelope right now and give myself an injury that's going to set me back even further? Or can I just be a little patient, do a little more strengthening, and come back strong, if not stronger than I was pre-baby?
Sounds a lot like parenting.
So I'm learning.
That's great. Well, I wanted to ask you, is there anything that you can give virtually, like maybe in the form of a basic exercise? You talked a lot about breathing. Would it be possible to kind of expand on that a little bit and maybe even give like some little tips and tricks that the audience can use in their daily lives, something simple and easy to understand that might help kick off some of that recovery for them?
Yeah, I think the first thing would be, let's talk about breathing. So what is a good breath, and what does that look like? So when you take a big breath in, you want to imagine your rib cage expanding in all directions. So basically from all sides of your rib cage, everything is expanding. The back, the sides, and the front. So you can even place your hands on your rib cage and take a big breath in, and you should feel your hands move away from each other. So I call it 360 expansion through all sides of the rib cage. And then as you exhale, you feel your hands kind of come closer together. And that's just saying everything is moving. You know, you're expanding in all directions. So then as you inhale, your pelvic floor also relaxes. And then as you exhale, rib cage comes in and the pelvic floor naturally contracts. So one thing I would encourage people to try is just that really deep breath all the way down towards your pelvic floor. Feel that relax. And then exhale just naturally. You shouldn't have to push out your exhale. Just kind of let the body exhale, you know, naturally. So that's one tip. Another tip would be, you know, kind of bouncing off this whole breathing thing, is to exhale when you're picking up heavy things. So like I was saying before, your pelvic floor naturally contracts and your core kind of naturally engages, if you will, on your exhale. So let's use that to our benefit. So you're picking up your baby out of her crib or his crib. You're, you know, picking up a weight for a deadlift. You always want to do the hardest part of the lift on the exhale. So to remember that, I think exhale on effort. E and E.
Yeah. Yeah, that's really good. I think a lot less people would have back pain and injuries if they did that. So I think that that tip is worth its weight in gold for sure.
For sure. Do you think, you know, especially for the postpartum woman, your abs get stretched out during pregnancy, and so you just don't have that core strength that you would have otherwise. So many moms just hold their breath, because when you hold your breath, it gives you a false sense of core stabilization. And what that ends up doing, unfortunately, is oftentimes it can lead to problems with the diastasis recti that we were talking about, and it also increases your likelihood of pelvic organ prolapse. So really managing that breath does a ton for our postpartum bodies.
That's great. Well, Anna, thanks so much for your time today. It was very educational, very informative for me, and I'm sure there's a lot of people out there that got a lot out of your presentation. So any last things that you'd like to say before we end our time together?
Yes, I would say don't hesitate to reach out. You know, the postpartum rehab doesn't need to take up a ton of your time. Even just a few visits, we can give you some tips and tricks to send you on your way. We're obviously really passionate about this stuff, and I want moms to feel strong, because when we feel good in our bodies, I feel like we can do the work as a mother better, and it's good for our health and well-beings and bodies. So please don't hesitate to reach out. Yeah.
Excellent. Well, thanks again, Anna. Anna Howes with the Women's Health Physical Therapy Program at Active Physical Therapy. You can see us online at stayactiveup.com. You can find us on Google. Give us a call, and we'll be happy to talk you through this process, get you in for a screening, and see what we can do to help you. Thanks again, Anna. I really appreciate your time.
Thank you.